It's my feel-good breakfast show.
Welcome back. You're live with Expresso. Time to be inspired to, I think, honor one of the greatest legacies we could. For the year of 2018, we, of course, celebrate what would have been the centenary of Tata Madiba, Nelson Mandela. And, of course, the Western Cape Department of Health has stuck their hands up to contribute. In his honor, they are performing surgery for 100 vulnerable members of society who are in dire need of life-changing operations, including nose, ear, hip replacement, knee operations, an incredible array and some very deserving recipients. We're joined this morning by the Western Cape MEC of Health, Dr. Norma French-Mbombo, and the Head of Department at the Western Cape Health, Dr. Beth Engelbrecht. Doctors, welcome. Great to have you back.
Good morning.
Dr. Engelbrecht, maybe I can start with you just to paint a picture. It sounds lovely when I say it there and an easy feat, but this is a system that is already under pressure. These are such deserving recipients. Can you explain the motivation to do this and in this way?
The key thing for us is to make a difference in people's lives. We do that every day, but now we find that very often the heavy trauma load push patients that wait for elective procedures off the theatre lists, and we've got long waiting lists. So it wasn't a difficult decision to say that let us do something that we do well, let us do it for free for patients that are deserving.
How much of a difference does this make? When I say life-changing, it's quite flippant, but that really is what it is.
Absolutely. So a patient who are blind because of cataracts, it's a 15-minute procedure and you change their life. They're not dependent on people. They can go to the toilet on their own. It is life-changing. People in pain with hip arthritis, all of those things, you absolutely change people's lives.
Dr. Mbombo, obviously I've mentioned, and I think we should all be taking cognizance of the fact that this is, yes, what would have been Tata Madiba's centenary year, but there is an opportunity there to do something truly remarkable. Why have you, as a ministry, gotten on board for this campaign? Why is this important to you?
It is important in the sense that, for example, whilst it's our responsibility to have these operations, but because of the long waiting lists, also with the issues related to the budget, we'll find that we are unable to. So that's why it needs a public-private partnership for us to add more to reduce the waiting list. Because some of them wait as far as for a year or two, for example, for the knee replacement. So for us to do it for Tata Madiba, it's very crucial, and it needs the whole society, because government alone will not be able to do it.
Is this setting a roadmap for future? I don't want you to obviously paint a picture of a time that hasn't been locked down yet, but will we see more of this kind of partnership? Has this sparked something that we can see being done every year, being taken to a greater level in the future?
Oh, yes. Last year we had 67 operations, so we asked for more, and this year we've got 100. Probably next year we're hoping for 200. If people could be able...
I was going to say, we've started with an exponential growth, so we've got to continue on that.
We rely, especially the corporate individuals, which they really contributed for this.
And they get to
and
benefit
also for the
from...
staff. Because for the staff, they have to also take extra time without necessarily getting more payment for such.
Yeah, and we already know they're under massive pressure. I think a very important question to me is, how do people get selected for this? What is that part of the process?
So, for example, the hip replacements and the knee replacements, we've got a kind of internationally researched waiting list mechanism by which there's the same criteria applied across the whole province. So we've got one electronic waiting list, but every hospital knows which patients are at the top of the list, and that must be done first. So that is a very fair process. The same with cataract surgery. We select people with one cataract or two cataracts. It depends on all of those criteria to be on top of the list, and they then get selected earlier. For the children with the tonsillectomies, again, these are children that has been waiting. So last year we focused only on cataracts and hips. That's largely in the elderly sector of the community. This year we're also focusing on children with ENT and also on women in reproductive health with sterilization marathon at Mitchell's Plain Hospital. We're very excited about that.
I think Tata Madiba would love the fact that you've broadened that scope. Just very quickly, the timeline on this, when is it going to be wrapping up?
The Madiba Day is on the 18th of July. We have already started some of the operations, but by that time, at least we'll get done with all of those, and then we'll make an announcement. And again, we appeal to the whole public, specifically the corporate, the business, won't be able to do it without you. Please assist. Do it for Madiba.
Yep, and benefit from this wonderful upswing in media attention around Tata Madiba's centenary year. Doctors, ladies, thank you so much for joining us this morning. Good luck
Thank you.
with the final phase.
you
And
very
thank you so
much.
much for bringing those life-changing operations to people who so desperately need them.